All right, folks, there's the guy with the bow tie for a special live right now. We're going to do a webinar real quick talking about COVID-19 and how it will affect employee benefits going forward and currently. Giving folks a second to check in. Hey, Jackie, thanks for jumping on here. Thank you, Queen. We have Kenneth Cannon. Hey, Kenneth, thanks for jumping in. Hey, Misha. Sorry you can't watch it now, but check it out later. Definitely relevant information. So I'm doing this now. I did a webinar for this Monday. I just wanted to keep it on LinkedIn for easier access for people. So we're going to talk about COVID-19 and employee benefits, health insurance, all the different things, so you kind of understand some issues that might be happening now or currently in the future. So let's get started real quick. So for those that don't know me, you can see my profile obviously on LinkedIn, but 7 years experience in the health insurance benefits world. And I'm agnostic with health insurance, meaning I don't care who the carrier is. As long as it fits the person's need, my job is to help find the best option for that person. So a couple of rules of the road real quick. Ask questions while we're doing this. You can feel free to type it in the comments below. Type your questions. I can answer them as we go. And that way we can stay on topic with everything. We're going to talk about that as well as the current state of health insurance, small businesses, what health insurance companies are doing right now, how the CARES Act affects things, and how to help your employees now and in the future if you have them, or if you're an employer yourself for that matter. So first off, how does a pandemic affect health insurance coverage? This is the first time the United States has gone through something this grand of a scale. We've had disasters here and there and things of that nature, but nothing where everybody had to deal with it at one time. So a couple of key changes health insurance is going through right now because of this pandemic: telemedicine, cost considerations, and prescriptions. Those are pretty much across the board big changes for most of the carriers right now. So first, telemedicine. There are new rules for telemedicine. Basically, every carrier, for the most part, and I won't say every, but majority of carriers are offering telemedicine at no cost to the employer, to the employee, the consumer, whoever has the health plan. There's no cost for telemedicine now. That's been that way for a couple carriers for a while, but now it's everybody, just because access to care is key. Because the key information about COVID-19 is to avoid exposure to those that are sick. So if you think you're sick, you're in this conundrum of how do I get care if I'm not supposed to be around sick people? So what you'll do instead is video a doctor on your smartphone, computer, tablet, whatever you have. That way you can have access to care that way. Next thing, expanded reach. Expanded reach basically means that now telemedicine can be offered across state lines. It was probably a week or two when the president signed that to have people have access to telemedicine away from their home and also away from their state. Because case in point, New York. New York is overloaded in their health system with COVID-19. So their doctors there are working like nonstop. So most of the doctors in New York probably don't have time for telemedicine to actually do an appointment. But a doctor maybe in Arkansas or Ohio or someplace that isn't as affected might be able to. So they're letting doctors across state lines treat people that way. There's less wait times and less of a burden on those in states that are heavily affected. Andrew, hey Andrew, you said surviving in captivity. We're all surviving in captivity right now. And please, guys, throw comments, questions as we're talking, kind of make this interactive. Hey Nick, Team Live, thanks for jumping in. If you guys don't know Nick Nelson, he's doing some great work on LinkedIn Live right now, or just in general about getting yourself noticed. So definitely check him out. Next thing, why do you use telemedicine? So why is it important? Again, for those that are sick or have a suppressed immune system, you don't want to be out around sick people. So the only way to do so is telemedicine. It's a great thing because you have a doctor helping you versus you Googling your symptoms. If anybody's ever been on WebMD, that website where you Google your symptoms or put in your symptoms of what you have, every time you put it in, you think you're dying. No matter what the ailment is, when you just search your own symptoms, you kind of make yourself panic and you might be totally fine, but the symptoms checker will show everything possible. So sometimes death might show up or you're dying. So rather than do that, you have an actual doctor with access to care and you can get prescriptions that way as well. Other great reasons, though, is increase access to care. Think about it. If it's 2 a.m. in the morning and you were feeling deathly ill and you're like, man, I need to get some medicine or go see a doctor, you don't really want to go drive to the ER at 2 in the morning. So instead of doing that, your first line of defense always should have been telemedicine. It's not a new thing. It's been around for a while. But your first line of defense should be telemedicine. Those of us with kids definitely understand this. You don't want to, run the kids around all the time for things. So pop your phone out, say, hey, I'm not feeling too hot. You tell them your symptoms, they can figure the whole thing out, majority over the phone. Usually about 63% of ER visits are not necessary. These are things like sinus infections, stomach blockage, headaches, things that might be major to you, but you don't know what it is. So at least with telemedicine, you can kind of cut that out the head. Reduction in resources. Think about how much goes into when you visit a doctor's office. There's paperwork that has to be done, hand sanitizer, gowns, all kinds of things had to be used just for a annual checkup sometimes. So to cut that down, you can actually say, let me just do this at home for something that's just minor. Hey, Dr. Carla, I love the message you sent me for my birthday. Thank you. And thank you for #TeamLive. Also a shortage of doctors. This is a major thing. The Association of American Medical Colleges actually projected that we'll be short 100,000 doctors by the year 2030. So think about that. There's less people going to school for medical work and more people being born. So there's an influx of more people than less doctors. So with that being said, we all know about waiting in the doctor's office 45 minutes for a 5-minute appointment or something like that. That's because they're short. It's only one doctor in that whole facility or wherever you are. So they have to see every single person. So if we're short doctors, they're going to just start cutting off appointments at some point, saying we only have this many appointments a day, and you might need it right then. So telemedicine lets you kind of not have to worry about that because you can talk to a doctor in a whole different state and get treated that way. It's also increased quality of care. Studies have shown that telemedicine, it gets better care because people will actually do it. Men are notoriously bad for going to a doctor. So if you can just say, hey, you don't even have to leave the house. You can use your phone, figure out what it is, and then if you need to, then go in. But it gives better quality of care because people actually get initial treatments and then they can not have things build up over time. So they find out stuff ahead of time. So that way, when they go in for their physical, they go in for a more intense visit, they have more information ahead of that. Also, time saving for providers and patients. The doctor will save time because, again, they just tap a button on their computer or with their phone, whatever they're using, and they can talk to you right then. And if you guys have used telemedicine, I want to see some comments about that. If anybody on the live has used telemedicine, throw a comment in there kind of saying your experience, or if you tried it before, just to let people know that it's worked for you. Also, nearly everyone can use it. At least 80% of adults have a smartphone. And I really think it's 90%, but studies say about 80% from what I saw. So if 80% of people have a smartphone, then that helps the uninsured portion because 30 million people in the United States don't have health insurance. And I think that's low, actually. It should be actually higher. But most studies say 30 million people don't have health insurance. So if they have a smartphone, though, they can say, you know what? I don't have health insurance. I don't want to pay $500 to go to the ER for a cold or what might be nothing. So they can use their phone because they have it. And telemedicine costs, if you get it separately from a health plan, usually the copays anywhere from $25 to $50 on average. And you can actually use telemedicine for therapy too, for mental health. So there's a lot of things you can do with that people are resistant to doing in real life. So they can use their smartphone to do it that way. Cost consideration, the next thing. So cost. So right now, everybody has to deal with this differently for each health carrier. So there's a blanketed statement for all health carriers that cost of COVID-19 testing should be free. So right now, if anybody's going through testing for COVID-19, there should be no cost associated with that. The challenge is, though, what if it wasn't COVID-19? You got a test and it wasn't COVID-19, then there's still some cost there. But think about it right now that every health carrier has blanketly said there should be no cost for COVID-19 testing if you can get it. Now, I know we're short on testing here in the United States, but you still have it for no cost to you. But right now, how much do you guys think it costs to go through COVID-19? I want to do a quick question. So type in the comments below, how much do you think COVID-19 costs somebody? Let's see what we get here. I'm going to refresh my comments because it doesn't show up as quick as you guys see it. All right, so how much do you guys think COVID-19 costs? Okay. Okay, let's go to the next slide. So average cost is $9,763 to $75,000. So it costs a lot. Now, the low end, the $9,763 is people that have health insurance, presumably, because of their co-sharing deductibles, all that basically raises it to about $9,000 going through the whole thing. So sorry about that. Missed a comment. Dr. Carl said 200. It'd be nice if it was 200. And Nick says 50,000. Nick, you were closer actually. The 75,000 is people that don't have insurance, because think about the intensive care overload we're having right now. You'll see in the news that intensive care units are overloaded. So people, that's not cheap. An intensive care unit takes a lot more manpower and price your equipment. So cost of COVID-19 on the low end, 9,000, high end, 75,000. So we have to think about that. That's a cost that everybody's absorbing, whether you have insurance or not. We're all going to deal with that because hospitals will have to front that charge somewhere. So 9,000 to 75,000. Prescriptions is the next thing. That's a big portion of COVID-19 changes. Easier access. So right now, those of us that take medications or that are on medicines of some sort, now you can get larger supplies than you normally could get, because they realize that it might be some months that this thing is going on. So they're allowing you to get easier refills, like you can get a refill sooner. So if you might have been, I don't need a refill to next month, for example, you might be able to get it like now, because they say, well, we might not have access to this doctor because he might go to New York to help fight the pandemic, or he can get sick himself, whatever. So you get easier access for refills and larger supplies. So that's a very big thing to think about. So if you have health insurance right now, just understand you can do that now. That's pretty much every carrier, any major carrier I've researched, haven't seen them not do that, but you do want to double check with your health carrier to be sure. But what's the current state of small businesses and their staff? So another question for everybody. So what percentage of businesses do you think offers health insurance right now? And again, I'm agnostic. This isn't a health insurance sales conversation. It's just to have you think about how this is affecting America. So what percentage of businesses do you think offers health insurance right now? Leave that open for a second. Oh, and Dr. Carl, I see your comment now. 200,000. You are on the high end. Not quite 200,000, but 75,000. But quick question. What percentage of businesses do you guys think offers health insurance? I should play Jeopardy music when I do this. I'm getting some messages on my other platform. Okay. So right now, and again, I apologize if I don't see the comments. LinkedIn is notoriously slow on the comments showing up for the person doing the live. Nick knows about this because he does live as well. So right now, around half of small businesses offer health benefits. And a last minute comment came in. Oh, that was Dr. Carl laughing at me. There we go. Around half of small businesses offer health benefits. Now, small business is usually considered under 500 employees for that measure, but it's really probably a much higher number if you kind of narrow the focus down to less than 50 employees, which is a large chunk of businesses. Only about 8% of businesses have 100 or more people. So majority of small businesses don't have health benefits, but if you look at the blanketed 500 or less people, around half offer health benefits. With that being said, employers spend about $5,000 per employee annually on health benefits. Now, that depends on the plan you have. That ranges from a MET plan, which is a low-cost, minimal skinny plan, they call them, where they cover just the basics, all the way up to your platinum, Blue Cross Blue Shield, $500 deductible kind of plan. So $5,000 per employee annually is what the cost is usually. Also, about half of employees have some kind of disability coverage. So that's going to be something where if they got sick like now, if they were sick and unable to work, it would pay them a portion of their income while they were at home getting better. So about half have health insurance, about half have disability of some sort, and 70% of employers have workers' comp. Now, part of that reason is because you have to have workers' comp in some industries, but it's interesting to see that on the left-hand side. Then on the right-hand side, we'll see around 30 million people are uninsured still. And I think that's really low. But again, half of employers have health benefits, so there's still 30 million people uninsured. Also, some modeling shows at least 15,000 retail stores will be closing. 15,000. So that means all the employees that were there will have no benefits now. If they had let's say half of them had benefits like the studies show, so 7,500 of them had health benefits, boom, they closed their doors, no health benefits for all these people. Also in 3 weeks, 3 million employees of restaurants were laid off. So all those people are dumped into that bucket of, I don't have health insurance now too. This could take about 3 weeks to get an unemployment check. So people that are applying for unemployment, my heart goes out to you. Stay strong. It's a slow process, but it says it's about 3 weeks to get a check for unemployment. So I'll be waiting for a while. And lastly, in 2016, because this data is always slow for this, only 1% of American workers miss work because of an injury on the job. 1%. So 70% of employers have workers' comp, but only 1% of people actually have to use it. So that's important to kind of think about when people have benefits or they have workers' comp but not benefits. Kind of shows you the logic's a little off, that the health benefits probably more valuable than the workers' comp because you use it more frequently. But what about the health insurance companies? What are they doing? So this is from Aetna, Humana, and Cigna. They're pretty much across the board the same on most of these things. So waiving copays for testing, waiving cost sharing for inpatient admissions. Still double check with the carrier if you're going through this, because they're saying they're waiving it, but it might still get a bill sent to someone. I saw someone on LinkedIn recently talking about their doctor bill from COVID-19 was, I think, $45,000 or so. And they had insurance, but it was a billing issue. So it's supposed to get waived from these carriers, at least. Some carriers aren't saying blanketedly we're waiving the cost. They're saying we'll waive the cost for testing, but other carriers aren't necessarily saying we're going to waive any kind of inpatient admittance. So for these three, they'll waive the copays, the cost sharing, and free telemedicine. So if you have Aetna, Humana, or Cigna, they've said that. Blue Cross is kind of on the fence about a couple things. Kaiser's on the fence. So whoever you have, go to their website, check it out, and see what the coverage is being changed to. So what about those laid off? So the people that are laid off, what can they do? That was a big concern for people because nothing in the care package had anything about health insurance being made available to all people. So there's two main roads. If you had health insurance through your job, the company should be paying you with the Paycheck Protection Program and the CARES Act. They should be paying you. If they're not, well, that's a choice to have, because if a business says getting a loan or something like that or keeping my doors open with no customers would jeopardize my business, I'm not going to do it. That's if they have 50 or less employees. They can actually opt to not follow the law with the CARE Act and say, I don't want to do it. It's going to jeopardize my financial situation. I'm just closing my doors and I'll try again later. So if you're in that situation, there's nothing really that can be done except for COBRA. You can get COBRA, where you keep your health coverage from your employer, the exact same plan you had. Just be mindful that two things, one for employer, one for employee. The employer, if they just drop everybody but a handful of people to keep health insurance, they can get hit with a penalty if they have 50 or more people. Because when you have 50 or more, you are supposed to have health benefits. So if you lay them off but keep it for a few people, you can get some penalties from COBRA triggering the fact that you're only offering it to a minority of people when you had it for all of them previously. So be mindful if you're in that situation to close your doors. The health care package or the CARES Act package, the funding can be used to pay for health premiums for your staff. So if you have health insurance now through your company and you have to lay people off and you do get a stimulus loan of some sort, that money can be used and is forgiven for paying for benefits for the employee. So keep that in mind to use that funding to help in that way. Also, big thing to remember with COBRA is that when you get COBRA, you don't have that employer contribution. So when you're working for somebody, you have maybe the owner pays 60%, 80%, something like that. But when you go to COBRA, the employer's not paying anymore. So in that situation, you're kind of on your own. So the rate might have been, let's say $100 every 2 weeks for your benefits. It might jump to $1,000 a month because your employer was paying a lot of that healthcare cost. So keep that in mind if you go to COBRA. You might see some sticker shock because of that. And then Nick, I just saw your comment. Nick, sorry, super late. I said 20. You said 20% of businesses offer health benefits. I think it's more like that in my opinion. I know they say half, but I think it's really like 20% in my opinion too, because I just see so often when it's less than 50 people, they just rarely have health benefits. And that's kind of what I try to specialize in, helping that size client, because they need help more than the Coca-Colas of the world and the Procter & Gamble. They need more help than those guys because they don't really have access to the same health packages. So I think I agree with you. It's about 20%. So the last thing, if you lose your coverage through your employer, is the marketplace. You can go to healthcare.gov, say, hey, I lost my insurance by employment, and you can actually sign up within 60 days of that termination date. So if you were laid off recently and you need healthcare coverage, go to healthcare.gov, go in there, pick a plan out. It'll be based on your income, age, and family size, and it's household income. This is important. It's household income. It's not just your income. It's the household income. So if you have a spouse that's working as well, it's both of your incomes combined. So go to healthcare.gov if you lost your insurance through your job or COBRA. Now, if you didn't have coverage through your job, nothing's changed for you. There has been nothing really put out there for those that were uninsured before this whole thing. So considering that, unless your state, you could be in a state that expanded Medicaid, then if you are in that kind of state, then you're fine. Medicaid will cover you. But Georgia, for example, didn't expand Medicaid. So we don't have that option here where people can just go to you get coverage that never had coverage before. So if you didn't have it through your employer and you didn't get it expanded Medicaid, you're kind of in the same situation. You can find private plans online, but be careful with private plans you find on the internet, just because They're not always the most best coverage out of everything out there, and it might be confusing the way it's written. So if you're going to find a plan online, it's okay. Just make sure you read the fine print or get someone to explain it to you, because it's not the most easy thing to understand. About 14% of people can understand health insurance. So keep that in mind when you're thinking about buying it online by yourself. Just get some help from somebody that knows what they're talking about. So why did COVID-19 hit so hard? What was the big reason why this hit so big? So there's two main angles: unprepared workers, unprepared businesses. So unprepared workers, remember that nearly half of all foreclosures come from a disability. Only 2% come from a death. So a house foreclosure, most of those reasons that happen is somebody got sick or hurt. It's not that they die. And it's odd because most people have life insurance. About 60% of people have life insurance, but they don't have something for if they couldn't work because people always think death is the most costly thing. And it is costly, don't get me wrong, but you only die one time. You can get sick several times, hurt several times. So people aren't planned for this kind of thing. So when people actually got sick from COVID-19, they were financially in a big bind because they had more medical bills coming up and they had no way to get paid while they're out of work. So that was a big issue that they weren't prepared for that. Also, think about this. If you save 10% of your income each year, 1 year being totally disabled can wipe out 10 years of savings. Because think about it, if it's 10% every year, then that means it takes you 12 months or 12 years to get down to a full year of savings. So if you're out for a full year, that's 10 years of savings gone. You just lost all that money because you wouldn't have anything planned if you couldn't work for more than a week or two. Now, also unprepared businesses. About 3.6% of the workforce is remote right now. And that's prior to COVID-19. Oh, refreshing comments, here we go. 3.6% are remote. So other than that, that means 97% of businesses didn't have any kind of a remote workforce plan. And that's okay because some businesses didn't have to do that. But a plan should be in place for how do we do this if we need to. And I think everybody's thinking about that now. How do we work remotely if we have to? So most businesses weren't planned ahead. And also that most businesses didn't have health benefits. About half of them did. I think Nick's price 20%, but let's say about half had health benefits. So a lot of them didn't know how to help their employees get seen if they were sick or they need to get testing. So a lot of them just shut their doors for the liability purpose of, wait, if you're sick and you can't get checked out, I just need to close this place down because I don't want the liability of one of my employees getting somebody sick with this virus. So that's why a lot of places just said, forget it, let's just shut down because they had no way to get access to care. So what do we expect going forward now? Everything's kind of up in the air, but what do you guys think? I'm gonna ask a quick question real quick. Do you think healthcare costs will go up, stay the same, or go down as a result of COVID-19? So I'm gonna leave this for a second to let the comments breathe. So I want you to comment, do you think health insurance rates will go up, stay the same, or go down as a result of COVID-19? Nope, and Marlon, I just saw your comment. It's super slow today for some reason. Thanks for joining me, and thanks for the bow tie, the birthday shout out yesterday. Thank you. So do you think health insurance will stay the same, go up, or go down as a result of COVID-19? And live has been very slow because everybody's going live nowadays. So please comment for that. So basically, a carrier cannot reflect their rates on losses currently. They are supposed to give their rates on expected, what's going to happen next year, is what they expect to happen, not what they spent. People commonly think that health insurance raises their rates as far as a company based on what they spent, but legally it's supposed to be on what they expect, because the idea was to not have them hit people with high costs because they had a lot of charges one particular month or year. But there is a caveat to that. If they have to dip into their reserves, then they can actually raise the rates. So more than likely rates will go up. Studies show us about a 4 to 40% increase is projected just now already, thinking with everything going on, because the projected cost of COVID-19 in the US is $34 billion to $251 billion for testing, treatment, and specialty care, that is, for COVID-19. And the cost is probably gonna be on the higher side, not the low 34 billion, probably 250 billion, because think about all the testing, all the doctors being employed, all these different things going on, that rates will most likely go up. But the estimates are 4 to 40% because of those reserves. So if they got to dip into their reserves, because think about it, some people have health insurance and use it once a year. So they have reserves built up from that, saying that, okay, we didn't have to spend as much because this one person only went once a year. But now if a lot of people are going, they're going into their reserves using cash they haven't had to use before. So that puts them in the bind to say, we got to raise rates to recoup this because we need a certain amount of reserves. An insurance company has to have a certain amount of reserves to pull from. That way, if everybody has to make a claim, they have a way to do so. So expect rates to go up. And I hate to say that, and it's probably sad to hear that, but that's just the honest truth of things. So how do we prepare going forward? Oh, and the comments just came up. Thank you, folks. So we had, I wish it, Dr. Carl, I wish it would go down, but it may go up. And Marlon had a comment. Currently, health insurance cost is down to support the fight against COVID-19. It will go up, however, is based upon historical medical data. So, yep, you're 100% right, Marlon. They have the data to look at that we spent a lot of money. We had to go into reserves. They couldn't just necessarily just say we're going to raise the rates, but just because they're going to go into the reserves, probably going to raise the cost up. So one thing to kind of deal with this is revamp benefits offering. These gaps should teach us. If you ever do the history of Aflac, there was a big cancer pandemic in Japan in the 80s. And back then, Aflac wasn't in Japan, but Japan actually reached out to Aflac saying, hey, you guys have cancer coverage. We have socialized health insurance, but we don't have any way to pay our people when they're going through these cancer treatments. So we want you guys to bring cancer insurance to Japan. So now it's Aflac's the largest insurance company in Japan because they're a very planned ahead culture. So that big pandemic they had, and I can't remember why it happened. If somebody knows, please comment. But that big pandemic they had them learn from that and basically put them in a position to think ahead and say, okay, how do we get ready for stuff like this in the future? So that helped them. So we can do the same thing here, kind of thinking ahead more, which is why I always say have a plan, not a plea, because planning ahead is going to be key for everything going forward. So a couple of things. Telemedicine is a must. Every company, I think, should have telemedicine going forward, whether they have a benefits package or not. Just get telemedicine just to have an option, because all these clients I work with, a lot of them don't have health packages, but they might have telemedicine to help them at least see a doctor if they feel sick. All of us just need access to a doctor. Not most, a lot of people are being healthier and you see people walking a lot more, exercising, and that's good. We're all being healthy, but we need access to a doctor sometimes, not maybe every single month, but sometimes you need access to a doctor. So telemedicine will allow you that luxury to use it when you need to. Also do a deductible assessment. Look at your health plan for yourself, your family, your business, whoever you have it through, and think about, can I or my employees afford this deductible? It's crazy when I work at a restaurant sometimes. They might have a health plan and the employee makes $20,000 a year and their deductible for their health plan is $7,000. That's like a third of their income. So you got to think about that. Is this deductible able to be paid if somebody had to use it in a bad situation? Like now, this is a bad situation where somebody might think they have COVID-19 and they find out, nope, it was just the flu, and they rack up a large doctor bill and they don't have the money for the deductible. So it's important to think about, can we actually afford this deductible if we had to use it? Also, income protection. The entire US panicked about, I'm not going to get paid for 2 weeks, because most people live check to check. The studies show as high as 74% of people of varying incomes live check to check. So even if somebody's a six-figure earner, they have a six-figure lifestyle. So income protection, the big thing to think about is, could I afford to not have money coming in? And if I can't, how do I plan ahead for that? So that's a big thing people need to reassess now, because we're not always going to have stimulus packages when things like this happen. If it happens again, who knows? Maybe the government says we can't do a stimulus package. And even when you see this package, some people don't get the same amount of money as everybody else if they have a higher income, or they were a certain kind of business that didn't qualify for, or they weren't in business long enough. So there's a lot of different gray areas to this that might be an issue. So if you plan ahead, you're in total control of that. So that's the main content for everything. I didn't want to take you guys too long. I'm gonna go live again today for Amazon, talking about Amazon selling. But that was the key points of COVID-19 and health benefits. So if you don't have a health plan right now, probably want to think about how to get one, just to get something. And then we had a quick comment from Marlon. HorizonBlue.com has telehealth and has had it for years now, particularly helpful for mental health care or medical conditions such as pink eye. Definitely helpful now for obvious reasons. Definitely. Yeah, I love telemedicine just because it just helps you save time. That's the main reason I like it, because I have 3 kids. It's better to just do it on your phone if you can, to not have to bother people and to not, disrupt your whole day. So think about all this information. This will be on replay. If you're having a tough time, like you're in an HR role, you have benefits for your business, you're the owner, watch this or share it with people that are in that same role, because I'm agnostic to it, just to share the information, because I really think this is a chance for us all to learn. If we all can learn from this, This will help businesses a lot. And a big piece I want to make sure people understand, the companies that respond to this properly will have a great culture for decades to come. The people that don't respond properly will have a hard time rebuilding their culture, because culture is just like a good relationship. It takes a long time to make it good, but it can be destroyed in a second. So keep that in mind too, with this cultural shift we're having with benefits and insurance and healthcare and everything, that people that handle it wrong, by case in point, laying their employees off, might affect them for a long time, or by not utilizing the CARE Act package to pay their employees where they're at home or to pay for their benefits. And people watch the news. Their employees are at home watching the news. So they know there are laws out there and packages of money around to help them while they're at home. And they might think, wait, my employer didn't do that for me, and they want me to come back? I'm not coming back. Because they'll think about that. It wasn't handled the right way. So if you're kind of in a tight bind right now financially, they think some of the SBA checks will start coming out this week or next week for the stimulus package money. So if you're in a tight bind, go to the SBA website, figure out the economic injury loans, go get the grant money that's out there for certain things, for small business owners, for entrepreneurs. Go do some research and find out how to keep your business afloat, because this is a big cultural shift that will affect the business for a long time if handled the wrong way. So that's the reason I wanted to share this information, just to make sure you knew how to handle this so that you keep your culture strong when this is all said and done. Thank you much, folks. You see my contact info on the bottom. Call me, text me if you have a question or anything like that. And I will catch you guys on the flip side.